Hi, my name is Nimra, and today I will talk about how to perform blood transfusion. Now, before I go ahead, I will talk about the purpose of the blood transfusion. Blood transfusion is to replace the blood cells or the blood products lost through severe bleeding during a surgery or increase in the blood count in an anemic patient. Now I will go ahead and do my assessment. Now for my assessment, I will check first for the level of consciousness and the level of knowledge and understanding of the patient. Now after I done that, I will go and get the baseline assessment of the patient, which is the vital signs, input and output, heart and lung sound, etc. After I done that, I will review the lab values or the recent lab values, like the complete blood count, CBC. After I check the lab values, I will ask the patient if he had any history of blood transfusion reactions. After I done that, I will go ahead and check for the IV insertion site. Now for the planning, I need to gather the supplies. Now what I need here is blood product, a bag of NS, blood tubing or the white tubing, biohazard bag, alcohol beds, and saline flush. Also, I need a tray, tape, and a venous access. Most likely it's a preferred for adult 20 gauge. And now for my procedure. As I'm walking up to my patient, I check and verify the medical order for the transfusion of the blood product. Now, after I done that, I will go ahead and check for the informed consent. After I checked for the informed consent, I'll go ahead and check for or request for the blood product from the blood bank. And then I'll verify the patient using two identifier, and then I introduce myself and explain the procedure. Hi, my name is Nimer. I'll be your nurse on this shift, and now I will be performing a blood transfusion. How you doing today? After I introduce myself and explain the procedure, I'll go ahead and provide privacy for the patient and also ensure safe environment, as well as I will ready my prime administration set and the normal saline IV. After that, I do hand hygiene, and then I use the help of the second nurse to reinsure that the blood product that we have is correct what we do here is we cross match the informed consent, the patient identification number, patient name, the blood group and type, expiration date, and inspection of the blood products for any clots. Now after that, I'll go ahead and check for the vital sign. Sir, ma'am, I'll check your vital signs. Can I check your blood pressure, your temperature, and your pulse rate and your respiratory rate before doing the transfusion? Now I open the blood set aseptically and close the roller clamp. I spike the bag carefully using a pushing and twisting motion. Now after that, I go ahead and fill the drip chamber halfway full. After I fill it halfway full, that's to ensure that there is no bubbles. Then I disinfect the Y injection port of the IV tubing, and then I regulate the IV fluid to keep vein open, or KVO. After that, hey ma'am, do you feel any chill, nauseous, any skin rashes? Do you feel okay? After I observe the client closely, I monitor the VS. Ma'am, I need to check your VS every now and then. Now, to remember, every 1 hour or in 1 hour, it's every 15 minutes. For 2 hours, it's every 30 minutes. For 3 or 4 hours, it's every 60 minutes. After transfusion or post transfusion, after 60 minutes. Now, when reactions occur to the blood transfusion, I immediately stop the infusion. Then I close the clamp and remove the blood product and run the normal saline, saving the IV line. After that, I assist for VS. Ma'am, I need to check your VS. Are you okay? Then after that, I go and call the doctor. Hey doc, a reaction occurred during the blood transfusion. Is there any orders that I need to take? Now the physician will order to administer medication. After that, I complete the blood form and send the specimen and the first voided urine. Most likely the best one is the morning one to the blood bank together with the unfinished blood bag. After that, I check the patient. Ma'am, sir, are you okay? Do you feel nauseous, chill? Do you feel any difficulty? Do you feel weakness? Do you feel pain? If everything is okay, you keep the IV line open. Now back to normal. While I'm doing the blood transfusion, I square the bag hourly to mix the solid with the plasma. That's to avoid any blood clotting. Now after that, I remove the gloves and do hand washing. After a while, the blood will be consumed. Again, I will do hand washing and wear my gloves again. And then I go and close the roller clamp of the PT set and disconnect the IV line And then I regulate the NSS line as prescribed, and then remove the blood bag and keep the line open for 1 hour or as the facility policy. If there is no late reaction, I discard the blood bag and the tubing using the disposable bag. After that, I remove my gloves and do hand washing. After that, I provide the clients comfort and safety and privacy. After I done my hand washing, I evaluate the client, the response and tolerance toward the procedure. After I evaluate, I document the procedure and other important data on the client's chart. And this is the story on how to do blood transfusion to